All right. My research is about the nurses' leadership styles in tertiary care hospitals. I am Nauman Qamar, student of MSc Nursing, and my previous qualifications and credentials have been mentioned here. The abstract of my study is as follows. The present study showcases the leadership styles of head nurses of tertiary care hospitals in Pakistan, basically Lahore. Purpose is to see that what type of leadership style is mostly practiced or adapted by the nurses. For data collection, quantitative methods are employed that includes a scale, namely LPS, least preferred coworker scale, and checklist to assess head nurses that either they are relationship motivated or task motivated. Two lists are made named as A and B for getting data about autocratic and democratic style respectively. Total sample from the population of nurses and head nurses was 35, so N is 65 as total, among which 18 are head nurses and 47 are charge nurses. From 18 head nurses, 3 are task motivated as indicated by the results, that is 17% of the total sample. 13 are relationship motivated, that is 72% of the total sample, and 2 are somewhere between the lines, that is 11.1% of the total sample. The checklist received similar findings that remain consistent, which further strengthened the results. It was concluded the democratic leadership style is most rampant in tertiary care hospitals. The head nurses are very encouraging and they appreciate every creative idea from their colleagues. They promote collaborative work. They support every initiative taken for the betterment. The head nurses of tertiary care hospitals share the decision-making and problem-solving abilities with their colleagues. Charge nurses develop a greater sense of self-esteem due to the importance given to their ideas and contributions. Now I'll proceed with the details of my research. Firstly, I'll present the introduction. Leadership in nursing is an art, a science, and ambition. It is based on personal qualities, on strategic skills, and also on the will to change the course and outcome. It can occur in all clinical positions performed by a nurse. Nurses are the backbone of any healthcare system. This is the utmost reality, and is the most significant statement that is heard almost all the time when talking about nurses and nursing profession. Leadership is generally associated with personal qualities, however, it is increasingly mentioned that it is also a professional competence. Therefore, it makes it mandatory to analyze the strengths and weaknesses of what is important to us and profession as a whole. The present study is the leadership style of nurses of tertiary care hospitals in Pakistan, specifically talking Lahore. Purpose is to see what type of leadership style is most practiced and adapted as told earlier. The methods for getting the required results are mentioned here. As you can see on the slide, cross-sectional research design is used to carry out the research, and it was hypothesized that nurses have the democratic style of leadership. The hypothesis was formulated based on the previous literature and the literature review that is mentioned. The population included the head nurses and the charge nurses of the tertiary care hospitals of Lahore, Pakistan, and a sample of 65 nurses is selected for the study, out of which 18 are head nurses, and the rest of the sample of 47 is collected systematically from subordinates of each head nurse to get a fully represented sample. The research instrument include meticulously formulated checklist and least preferred coworker scale, which is interpreted as if score is 73 or above, the person is relationship motivated leader. If the score is 64 and below, the person is task motivated leader. If score is between 65 and 72, it's a mixture of the two. Results and the scores are mentioned over here, as you can see in the table that I've made. So the scores of head nurses on the LPS scale, possible highest score that one can achieve is 144, and the possible least score on this scale is 18. Score of 73 or above indicates that the person is relationship motivated. Score of 64 and below, it indicates that the person is task motivated. So based on the results, the score between 65 and 72 is mentioned as mixed. So the total score of the total sample is 1558, and the mean of this sample is 86.5. So 86.5 falls in the category of relationship motivated. As you can see over here, the score of 73 or above, that equals relationship motivated. Down below on this slide, you can see some more data spread for the checklists A and B. The data can be seen here according to the number of subjects and according to the name of the list. The score of the representative sample of charge nurses on the checklist A and B is as follows. The possible high score on checklist is 10. The possible low score is 0. High score on checklist A equals autocratic. High score on checklist B means democratic leadership style. Equal score on either checklist that indicates that it's a mix of both. Total score on checklist A equals 257 and total score on checklist B equals 276. Mean score on checklist is 5.4 and mean score on checklist B is 5.8. The present study is about the leadership style of head nurses in the tertiary care hospitals. Carrying out this study by using observation skills and checklist, it was revealed by the democratic style is most pertinent in all head nurses in tertiary care hospitals. Democratic leadership style is the most effective style. Group members are encouraged to share ideas and opinions. Members of the group feel more encouraged in the process. Creativity is encouraged and rewarded. Democratic leadership style leads to higher productivity. In democratic leadership style, the staff readily accepts policies, decisions. The head nurses are very encouraging. So we were on the conclusion part of the presentation. The head nurses are very encouraging and they appreciate every creative idea from their colleague. They promote collaborative work. They support every initiative taken for the betterment. The head nurses share decision making and problem solving and the responsibilities of the colleague. Charge nurses develop a greater sense of self-esteem due to importance given to their ideas and contribution. Leadership style towards staff nurses show significant effect of productivity, efficiency, and reflects positive or negative patient outcomes. So that was the conclusion, and lastly you can see here are some of the important references from the research I've quoted here.